Hello and welcome. The American Heart Association and the American Diabetes Association, along with industry leaders, have proudly launched the groundbreaking collaborative initiative No Diabetes by Heart to reduce cardiovascular deaths, heart attacks, and strokes in people living with type 2 diabetes. The No Diabetes by Heart initiative supports quality improvement efforts by engaging directly with hospitals and outpatient clinics to provide long-term support to their teams of professionals as they redesign healthcare to better serve patients with diabetes and cardiovascular disease. AHA's Target Type 2 Diabetes is a component of this broader initiative. Target Type 2 Diabetes is designed to help healthcare organizations better apply clinical guidelines, monitor care processes over time, and use these insights to inform constant and deliberate change to improve the lives of the patients they serve. Target Type 2 Diabetes Honor Roll aims to ensure patients with type 2 diabetes receive the most up-to-date, evidence-based care when hospitalized with cardiovascular disease or stroke. To bring attention to this critical high-risk population, American Heart Association has established the Target Type 2 Diabetes Honor Roll recognition opportunity for hospital participants of Get With the Guidelines Heart Failure and Get With the Guidelines Stroke. Hospitals with these modules have diabetes-related registry elements and reports in the patient management tool and IQVIA registry platform. Hospitals that meet specific measures thresholds based on these elements may be eligible for recognition in the Target Type 2 Diabetes Honor Roll alongside their existing Get With the Guideline awards. You can learn more about the Target Type 2 Diabetes Honor Roll recognition criteria, measure descriptions, and more by visiting each of the pages linked here. If you're not yet participating in the Get With the Guidelines Stroke or need assistance logging in, reach out to Get With the Guidelines support at heart.org with your full name, hospital, and location, and one of our staff members will connect you with your quality representative. In this video, we will focus on running a report for our demo site for this current award period related to Target Type 2 Diabetes Honor Roll. We will start by logging into the PMT. Once you've entered your username and password, find the Get Started section on the upper left of the page. We will use this as our main navigation pane. Here you'll find an option to run the stroke reports, and you'll do so by clicking the colored bar chart icon. When you click on the icon, you'll be taken to a page that says Reports User Manual at the top. First, you'll click on Configurable Measure Reports under Site Level Reports. This page contains numerous standardized reports, including award progress reports, descriptive reports, and more. To the right, you will see links to measure description PDFs that define every report. Here at the bottom of the list are the full descriptions of all Target Type 2 Diabetes Honor Roll measures. Let's go ahead and run a progress report for the current award period, which is January 1, 2021 through December 31, 2021. Again, we are reviewing demo data. For interval, we'll select annually. You'll see that from and to are auto-populated. For report 1, you'll go down to the third dropdown under Select Measures. As you can see, there are several dropdown menus to select from when running a report. Today, we'll focus on the Target Type 2 Diabetes Honor Roll report, which is located in the third dropdown, Get With the Guideline Additional Patient Population Measures. We will scroll down until we locate the bolded section header labeled Diabetes. The Type 2 Diabetes Honor Roll uses an overall diabetes cardiovascular initiative composite score to determine award eligibility, defined as the proportion of performance opportunities met among eligible opportunities for all diabetes award measures shown here. In other words, we will sum the denominators and numerators for all those measures and then calculate the percentage which will be used for the composite score. As a reminder, hospitals must first qualify for a silver level or higher Get With the Guidelines Stroke Achievement Award in order to be eligible for Target Type 2 Diabetes Honor Roll. Again, we encourage you to read more about the recognition process and the requirements by reviewing the resources available on our Type 2 Diabetes page. Let's get back to our report. As you can see, you do have the option to select Diabetes Achievement Measure Group, which will run the composite score, or you can look at the measures individually. For this video, we'll start off by running the composite score by selecting Diabetes Achievement Measure Group. You will choose Bar Chart, My Hospital. You won't need to select any filters to run the award measures, but this is an option if you're looking to narrow down your search. We do not have to select anything under display options. The last step here is to click Generate Report. When you run the Diabetes Achievement Measure Group report, you'll see a composite score at the top followed by the individual measures. Please note this is a demo version of what you'll see on your site. The diabetes composite score requirement for stroke is 80%, so you can see that this number is only 70.4%. If your percentage is not where you'd like it to be, or to better understand what's driving that percent, we can look at where we stand with each of the individual measures. What we're looking at here is a list of all the individual measures that roll up to the composite score. On the first one, we're looking at for all the patients with diabetes and those who have a diagnosis of ischemic stroke or TIA and have AFib or A-flutter, that they're discharged on anticoagulation therapy. As you can see, this one is at 100%, not an area of improvement. We'll continue to scroll down. We have antithrombotic for patients with diabetes, which is only at 66.7%. We could think about coming back to this metric as possible area of improvement. As you can see, diabetes treatment is at 66.7%. We have a few that aren't entered, a few that are at 100, which is good. So once you identify which measures you'd like to improve on, we can run patient reports for those. For example, antithrombotics for patients with diabetes is one we could focus on improving on. Once you identify which measures you'd like to improve on, we can run reports for those. For example, antithrombotics for patients with diabetes is one we can improve on. We'll run a report to see fallout so we can make appropriate follow-ups to patients who may qualify for certain therapies. We'll go ahead and close this report. If we want to run a patient's record report to specifically see which cases are falling out of the numerator, we'll follow the same steps, except we'll switch the format from bar chart to patient records. First, we would click on the third dropdown and select the measure under diabetes that you'd like to focus on. For this video, we'll choose antithrombotics for patients with diabetes. Instead of bar chart, we're going to select patient records. Once we select patient records, several select fields will gray out as they're no longer available. We just click Generate Report. We can now see a table. We can work with the online version of this table. There are filters. We can click Show Filters, and this is very helpful in trying to narrow the report down. Just a note, you can export this report to Excel if you would like, clicking Export to Excel. We recommend first to filter to say which of these patients are included in results, meaning that they're included in the denominator. You do so by clicking this arrow. In the numerator, the ones that say no are patients that are eligible for this measure but are not meeting the requirements. So this table gives us a snapshot of key data elements so we can try and figure out what happened here. This is an ischemic stroke patient. They were discharged home. It seems like the question about the antithrombotic medication was left blank. So this means that there was no indication that there was a contraindication. It doesn't say no, they didn't receive the medication. Instead, the section was merely left blank. The nice thing about using this live environment is that you can click on the patient ID and then it'll take you directly to that patient. We're looking for antithrombotic prescribed at discharge, so we'll click on the Discharge tab. This patient under Discharge Treatments, you can see that this question wasn't answered. This would be a good time to check in the medical record if this wasn't documented, or if the patient truly was not prescribed an antithrombotic medication, or if there was indeed a contraindication. If there was a contraindication, this would not affect award eligibility. These reports will guide your team on creating a targeted improvement strategy for guideline-directed care. The reports we have quickly provided an overview today is focused specifically on metrics for target type 2 diabetes honor roll recognition. If you'd like to learn more about this reporting tool beyond just measures related to diabetes, please check out the Getting Started video and coding instructions in the description to learn more. Thank you so much for tuning in to this quick overview of the Target Type 2 Diabetes Honor Roll reports and the patient management tool for Get With the Guidelines Stroke. We hope this guide helps your organization track adherence to the latest guidelines for diabetes care and manage diabetes therapy metrics that can improve your patient health outcomes, as well as your organization's recognition in the Target Type 2 Diabetes Honor Roll initiative.